Chemical versus thermal burns. How to identify and treat them. Imagine accidentally touching a hot pan or spilling a strong chemical on your skin. Both situations can cause burns, but knowing how to tell them apart is key to proper first aid. Thermal burns happen when your skin comes into contact with heat sources like flames, hot liquids, steam, or hot metals. They can look different depending on how deep the burn is. First-degree burns are red, painful, and dry like a sunburn. Second-degree burns might blister, look moist, and be very painful. Degree burns are more serious, with white, waxy, leathery skin, and can sometimes numb the area because nerves are damaged. These burns can happen from flames, hot liquids, or contact with hot objects. Chemical burns are caused by contact with corrosive substances like strong acids, alkalis, or reactive chemicals. They can damage tissue immediately and look different depending on the chemical. Dry chemicals like powders might need to be brushed off before rinsing with water. Liquid chemicals cause rapid tissue destruction and need quick action. Chemical burns can affect skin, eyes, or mucous membranes. Eye exposure needs special flushing techniques to prevent blindness. When treating thermal burns, start by cooling the area with cool water for at least 10 minutes. Do not use ice or very cold water because it can cause more tissue damage. Cover the burn loosely with a sterile nonstick dressing to protect it. For minor burns, pain relief and keeping the area clean might be enough. For larger or deeper burns, seek medical help immediately because they may need surgery or skin grafts. Watch for signs of infection or fluid loss, especially with big burns. Chemical burns need quick action too. If dry chemicals are on the skin, carefully brush them off before rinsing with water. For liquid chemicals, remove contaminated clothing right away to stop more exposure. Rinse the affected area with plenty of water for at least 15 minutes to dilute and wash away the chemical. If your eyes are affected, hold the eyelids open and flush from the inner corner outward to avoid spreading the chemical. Do not try neutralizing the chemical with other substances or applying ointments unless a medical professional says so. After initial first aid, get emergency medical care fast because chemical burns can keep damaging tissues beneath the surface even after rinsing. Always stay safe yourself when helping others. Use protective gear if possible, especially with chemicals. Know where emergency showers and eye wash stations are in workplaces or labs. Keep burn supplies like sterile dressings and clean water nearby. Assess how bad the burn is by checking how deep it is and how much skin is affected. Large or deep burns need urgent professional treatment. Never apply ice or ointments unless told to by a doctor. In situations with many injuries or chemical exposure, quick triage and decontamination are vital to prevent further harm. Remember, thermal burns come from heat and are best treated by cooling and covering the skin. Chemical burns requiring immediate removal of the chemical and thorough flushing with water. Recognizing the type of burn and acting fast can make a big difference in recovery.